in the, right in the.
I'll say that. I've
In the nonprofit sector. I said nice things just for the record, if you about you. In the nonprofit sector, give us great hope for your success. Anyone who can handle a demanding public as one of the leaders of the Metropolitan Washington Airports Authority should be able to take on the challenges of the architect's job. You arrive as the AOC faces a backlog of substantial facility renovation needs, both immediate and long-term. New construction projects requiring design and implementation, and continuing turmoil in the AOC workforce regarding discrimination in the workplace. You will have our subcommittee support as you tackle these issues. A smoothly functioning AOC is important to all members and staff, but we will have to ask you to do more with less. A 15% budget request increase this year, $102 million, is not likely to be in the cards, given our essentially flat budget caps. We're looking forward to your testimony today. You can give us your oral remarks now, and your complete opening statement will be included in the record. May begin.
Thank you, Chairman Ryan, Mr. Ruppensberger, and members of the committee. Thank you for the opportunity to testify today in support of the Architect of the Capitol's fiscal year 2021 budget request. In my 7 weeks leading this agency, I've been very impressed with the dedicated public servants who work for me. They are motivated and have committed their careers to serving Congress and the Supreme Court, preserving the America's capital, and inspiring memorial experiences. The agency has had some challenges in the past few years, but I am confident in our upside potential. I honestly feel the best is yet to come for the Architect of the Capitol. This budget request is really a continuation of the priorities of last year's submission. Last year, with the help of Congress, the AOC was able to address some of our critical needs. However, we still need to increase resources to central services to support our project requirements. Most of our project requests this year are follow-on phases of existing projects designed to serve Congress. The new projects will only strengthen campus resiliency. I respectfully request your sincere consideration for this budget. Additionally, I ask for your support as the AOC takes a proactive posture to help fight against COVID-19, which has now just been labeled as a pandemic by the World Health Organization. I'm happy to answer any questions you may have.
I appreciate that, Mr. Blanton. We're going to start off with
Mr. Blanton.
A Washington Redskins fan.
No, Ravens all the way. Don't. I could lose an election if that got out. If you said
the Ravens are actually the Cleveland Browns.
No, the Cleveland Browns are the Cleveland Browns, and our Colts were stolen too. So.
Oh, there you go.
Okay.
We'll go through some therapy here for our football program.
You like Ohio State?
Go ahead. I sure
Okay,
do.
good. Okay.
I have to admit I was a Colts fan.
There you go. So Johnny Unitas was a good friend of mine. Coaches kid in lacrosse. Oh, we're in another hearing. I forgot. Yeah. Okay. First thing, you have a tremendous job. I think you're the right person for it. The Capitol complex is your entire jurisdiction, and from what I understand, that includes the Library of Congress, the Supreme Court, Botanical Gardens. So there's a lot there. You oversee 36 buildings, and you have to maintain these aging facilities, and you have thousands of people coming. And so, but you know what you have to do, and I'm glad you started out by talking about your people. Any good leader will tell you you're only as good as your team. Give them a mission, hold them accountable, give them the resources to do the job. I know that in your budget submission you asked for legislative language for the Architect of the Capitol Reimbursement Fund. And can you talk a little bit more about what that is? What are you looking for there? How would you manage that type of thing? And how would it manage your backlog?
Yeah. So, the reimbursement fund would enable us, as I have centralized staff who work, who are only project funded. So they are term employees, and these employees will work for a specific project, and when they're done, they would go on to an additional project. What this fund allows us to do would be operate more in a business-like environment where I'm able to, when they're not working on projects, actually fund their leave, overhead, and other items that are associated that are non-work and training that are non-project related. The revolving fund is not uncommon in the federal government. When I came from in the Navy, we had the Navy Working Capital Fund, which all the public work centers who maintain the bases, they used. And basically, these funds would enable us to not have to use what we are currently using in the Adjustments Act to fund people to work on projects. Admittedly, the Adjustments Act is probably one of the most challenging ways for us to possibly manage our funds. A single project may take upwards of 1,000 adjustments of lines of accounting just to fund one project that we get in one line of accounting from Congress. So what this would do would allow us to more efficiently leverage the resources of our organization and to apply that to a project.
What other federal agencies do this?
So GSA uses it.
Okay.
I believe the Army Corps uses it in some aspects of it. The Navy has gone from using it to not using it to using it again to not using it. It's kind of gone back and forth. And for other agencies, I'd have to go and do some research.
Well, you know, you're new, you come in, and I like the fact that you're looking for a way to save money and to be more efficient. And more importantly, the biggest problem I think we have in government generally is the bureaucracy, cutting through the paperwork, cutting through the issues. Let me ask you this: in the projects that you have in this huge complex, what percentage of contractors do you use in the past? I mean, you just gave me your
the bulk of it's contracts. I can't give you an exact percentage, but I can tell you the bulk of it. Most of the work that we have to do, if you think about it, our line item construction program, that's almost all contractors, simply because of the large nature of the projects.
Now, how do you, are they competitively bid? How does that process work?
Yes, so we have pretty stringent acquisition regulations that closely mirror the executive branch for the FAR, the federal acquisition regulations. And so in general, all of our construction projects are competitively bid. Now, what we do have is multiple award construction contracts. These are contracts where we have pre-screened a pool of contractors and said they have met the technical qualifications, and then we'll go out with them for bid on a specific project.
And that's really important, because just to have contractors and whoever has the lowest bid, sometimes you get incompetence. So you do have pre-screening of all your contractors before they're even allowed to bid.
Well,
so you're not going to get a lousy contractor.
Yes, that are associated with that multiple award construction contract.
Okay. Okay. Well, good luck.
You were talking, if I could just follow up.
Sure.
On the Navy piece, and the Navy did it and didn't do it, and you went back and forth. What was the rationale in each of those instances, do you know?
So I have to say, I don't know 100% the rationale.
Yeah.
But I know part of it was they wanted full cost visibility. One of the great things about a construction reimbursement fund is you give the visibility of, full visibility of costs associated with any person working on any project.
Will the contractors be involved with that too?
No,
Okay.
no.
Well, I like the fact that you're looking for ways to be more efficient, to save money, and if we can help you through, the chairman said he wanted to help you any way he could in his opening statement. I think that's positive, and you know, we'll try to help you if it makes sense.
Thank you.
Go back.
Great, thanks, Dutch. Ms. Butler, do you have an opening statement you want to make? You're more than welcome to, or ask any questions.
Any questions?
Whatever you do. Yeah.
Thank you and welcome. I know this is your maiden voyage before the committee, so congratulations. Although I'm not going to lie, I'm also like consolation because this is a difficult. It's so critical to everything that we do here, but there's obviously a lot of big projects and taking place. And I want to ask you about. I want to ask you about cleaning methods, but first I wanted to ask about canon renovation costs. And have you gone through this already? Okay.
We haven't asked anyone.
I wanted to ask about your initial observations with the project. Obviously, there have been some really well-documented challenges. And I wanted to get your take. This is your field of expertise.
Yes. So It's clear there were some missteps by the organization. Part of it was underestimating. There was an aspect, too, that the estimate was in a 14, 15-year dollars, and we're in a program that we're executing in 21, or we're asking money for, well, actually, it's 20 through 24. So unfortunately, we didn't ask to bring the money up to the year of execution dollars. Another issue that we had was frankly, we bid off the most challenging phase first. And so we could have cut our teeth in other phases and come up with some lessons learned before we had the most challenging phase. But I'll say on the bright side, if you look at the way we're executing the current phase, we are currently within the budget, and we are currently on schedule. We plan to do the phase delivery. There was several lessons learned from this project, from change management, from the unknown materials, hazardous materials that were in there and that we were accounted for in the latter phases, and the idea too that we're going to deliver a phased delivery of the rooms as opposed to trying to deliver them all at once is going to enable the contractor to prioritize earlier some of the trades that he would need to do to get the phases delivered while still working on other parts of the building.
Yeah, I appreciate that.
So
Do you have-
that's a few, can you
Yeah,
move
go.
down?
No,
That's
go
a
for
lot
it.
of money, though. The overrun, right?
Yep.
Was
Yes, it is a significant amount.
Over $100 million?
And we're not done. I think
We're not
that's-
done, $137 million.
So that's,
I mean, that's a lot to just say, hazardous material and, I mean, that's, what was the, like, can you break down, and I know you didn't do this, so we're not,
Yeah.
this is, we have to understand, because
Yep.
we gotta go home and explain to our constituents, you're the chair of the committee, and you had a $137 million overrun. My opponents would love to talk about that and blame me for it, when it was really Dutch's fault, so.
I accept responsibility. Yeah.
But, is there, can you break that down into categories as to what the overruns?
if you want the exact dollars, I'll have to get back with you with the categories, but I can tell you a significant amount of it was the fact that when you bring it into current year of execution dollars, that was a large chunk of it. And additionally, the hazardous materials were much greater than we ever did anticipate. And again, I'll take back for a record, I'll come get and break down the 130 precisely for you.
Okay. And the hazardous materials were where?
So there was asbestos and caulking that we didn't believe that was existed. There was some more asbestos in the walls and lead, and much more lead than we actually anticipated.
Sorry, Mr. Butler.
So you don't foresee this moving forward, those types of,
No, they're accounted for in the later phases. So what that 130 million does, 130 plus million does, is account for the entire program difference. And so at this point, we're at a 90% level confidence on that estimate. And we worked in partnership with GAO to come up with that number.
and I assume you provide updates to the chair and I, or maybe we can ask, just that someone is making sure, I don't know, quarterly? It seems like a good, you get those quarterly in terms of progress updates,
Yes.
okay,
We-
good.
We do provide regular updates, and we can make sure they get passed on to you.
Wonderful. And so I don't know if this is, I think this is under your jurisdiction. So cleaning mechanisms being used around campus with regard to coronavirus. I'm
Yes.
one of those that believes we do stay with the ship. There's no closing. We're here to work. That's my opinion. But in doing so, we then need to make sure that we are keeping it as safe as we possibly can. One of the things I've observed over the years, so, people who, I don't know if they're employees or contractors who come through and they'll clean, for example, the offices. I've watched with, and part of this, you say it's neurotic, I had a kid in a NICU for a really long time. So I paid attention to all this sort of thing. So they would come in, use one set of gloves, they'd empty all the garbages, keep the same set of gloves on, clean the bathrooms, use the same set of gloves and clean surfaces, and then leave to the next room, may or may not change the gloves. I mean, that's a pretty basic protocol. I'm curious, who's in charge of making sure, number one, that those things are done right, number two, that there's a heightened and informed protocol for those folks now under the current the fact that we're going to stay open and
Yes, thank you for
Thanks, Dean.
those questions. It's very valid. We have taken a very proactive response to the coronavirus. And in fact, as you may or may not have read, we've increased the cleanings in the jurisdictions, so that all of the office buildings from 2 to up to 5 times a day. We are doing much better cleaning, much more robust cleaning to areas that are high-touch areas, such as handrails, buttons on the elevators, doorknobs, and things like that. So the protocols are clearly much more high.
Can I ask, is the protocol to change your gloves and/or wash your hands when you leave bathrooms? And what you do in a bathroom, you know, if you're going to clean stalls and then you're going to clean the sink, what order? Has someone thought through the order that's all done and the proper technique?
Yeah, I'll have to get back to you exactly on that. I will say, in regular janitorial business, the people wear gloves to protect their hands more than they are meant to protect it from sanitation, because they're typically not doing the deep clean.
Who does the deep clean?
Well, we have our regular cleaning protocols, which are twice a day. But the deep clean protocols are even higher and more stringent, where we're following CDC guidelines for how to do offices in the case of a coronavirus.
So that's one thing that isn't, I would like a response on in the near term, whether or not people are, so in a hospital, right, you go in one room, you sanitize your hands, you wash your hands, you do what you're going to do with the patient, and you wash on your way out. Before you enter another room, you do the same. And that's a normal protocol. So if someone's cleaning a bathroom and they come in, they shouldn't then walk out with the same set of gloves on and then walk into a member's office or to clean handrails. That's just basic. But in this environment, I guarantee you CDC has a protocol that could be used that could inform how people are doing it, in addition to trying to sanitize, right? They're not just picking up stuff on the, but you see them wash the stalls. At home, I'll tell you, I'm a big fan of bleach. But again, you don't use the rag on the toilet that you're going to use on the counter, and I'm not confident that I have seen that take place. So.
Okay, I can say that we have adopted the CDC's protocols for buildings in the coronavirus, and we've actually gone to the attending physician and had him look at our protocols, and that's what we're following now. And what I'll do is I'll get back to you with the exact list of what the protocols are that we're following, and CDC is.
Get back to the whole committee on that.
Okay.
Yeah, and just how it is being disseminated to the people who are actually doing the work. I've often said that the people who clean a hospital are they're just as important as a surgeon, because they're the one that help keep the infections at bay. And in this environment, I think the same is going to be true.
Yeah, I would like that as
Thank you.
soon as you can.
Appreciate it.
We can get that quickly.
Thank you.
I got a few questions here for you, Brett. I know when you were getting interviewed, you made some strong statements regarding the discrimination issue, and you were going to take that very, very seriously. We have read reports in the press of racist and sexist discrimination at the AOC that has reached the level of lawsuits. So while I know that these situations predated your arrival, one of the attorneys involved has stated that your office has not taken any steps to put an end to racist and sexist behavior. Can you just let us know what you're doing to prove to us that you will indeed not tolerate this kind of behavior and really push through the kind of culture change that we all want to happen at AOC?
First of all, I want to reaffirm my commitment to having no tolerance for racism, discrimination, or sexual harassment. That is a bottom line statement for me. Secondly, I don't know who said that we haven't put any changes in, or we're not making any changes, but that is fiction. My guess it was somebody who was trying to make a statement to bolster their side of the case. What I have done since getting there is signed out very distinct policy memorandum to my staff, explicitly saying what my policy is about zero tolerance in a language that they can understand. I'm targeting not only the people in my executive leadership, but I wanted to target the blue-collar supervisors, so they can speak in my words to their staff, and the white-collar managers, so they know exactly what I'm saying and speak in their staff. Furthermore, as we are changing the culture of AOC, well, one of the changes I did is we were trying to do this from the executive leadership position. And again, I thought the right answer, and I'm still convinced the right answer what we're going to do is we're going to target the blue-collar supervisors, the white-collar managers, and the executive leadership at one time, so we get everybody hears consistent messages, and they all know that they're going to be held to the same standards.
And what's the response been from?
So far, what I've
some of the
the
managers?
response has been positive. I can say that we are dealing with a culture. It's a strong culture that has been grown up in the construction industry, which is admittedly has taken a longer time to progress than other industries that are more sedentary in nature. And so I'm confident, though, with my leadership and me holding them accountable, that my staff will hear clearly that I want to have clear lines of accountability, authority, and transparency. And so with that, I'm 100% confident that the culture is going to be a culture where people are going to want to work there, and they're not going to have fear of harassment or discrimination.
It's good to hear. Anything we can do to help you, we certainly want to do that. We talked a little bit about the coronavirus, and is there anything, do you have any plans in place should we have to, or people in your food chain get sick? How would you handle that to try to keep up? Obviously, there's maintenance, basic maintenance that still has to be done.
Yes. So we have augment contractor personnel that we could use. We've already notified the union, and we have a plan should we end up having gates of percentage of people that drop, how we would augment the force. The key for that is we've also reached out to them and said, hey, you are a critical contract, so if your subcontractors are worried about this, get secondary subcontractors in, because we hired you to perform a very specific mission, and should we get to a point where a large percentage of my staff can't come to work. And again, this could not even be sickness. This could very well be a county shuts down their schools, and then all of a sudden 25% of my workforce has to stay home because they don't have daycare. And so once we get to that, we have gates that once we trip those, we're going to bring in augment staff.
Okay. So talk to us a little bit about, I know we're talking about renovations to Longworth and Rayburn as well. The Canon is obviously an issue that we're going to continue to talk about, but the Rayburn and Longworth are something we want to start anticipating a little bit more how to handle it. Evidently, it's complicated because the requirement until now to work around member and committee offices is in a rotational pattern. And apparently when the legislatures of Great Britain and Canada went through the similar massive building renovations, they completely cleared their office to reduce the time and cost of renovation. Have you looked at that at all? And
I definitely think that's something to consider, but I think it needs to be considered in a larger program in my mind. And it's what I'm calling our 50-year vision. And what you'll see starting late spring, early summer, we're going to start the kickoff meeting of the Capitol's Complex's 50-year vision. And I view you and your staffs as key stakeholders to this vision. And what this will do is really serve as the North Star for our facilities decisions for the next half century. And so with that, we would be able to look at how we would create swing space for renovations of buildings, what other parts of our Capitol complex can be used for other facilities needs during these types of renovations.
you think is that more efficient?
I think it's worth considering. There's both the ability to have operational efficiencies that way, but then there's dollar values, the dollar efficiencies. If we were to take a building and just a theoretical discussion at this point, it's not necessarily Longworth or any other building, and be able to have it vacated and renovated in 2 years as opposed to over 8 years, just by the cost of money. Over that period, we're going to save money.
I'll do one more question, Mr. Newhouse, where you can get maybe a question that you have. AOC is landlord for the alternative computing facility. This is something that we've been talking about at the staff level or here with our committee staff. It currently needs substantial renovations at its current Tier 1 level capacity and tens of millions of dollars in upgrades to achieve the Tier 3 capacity some of its users want. Given that multiple private sector data centers exist nearby that could potentially be leased without the maintenance and renovation costs of the ACF, does it really make sense to hold on to and renovate the ACF, given the cost?
Yes. So the ACF as a building houses other missions outside of just at the alternate computing facility. So if we were to look at, and it is worth considering, looking at from a cost perspective, is it cheaper to lease space in Server Farm Alley? I mean, if you think about it, the computing centers out in the western part of Fairfax and Loudoun County, that's the bulk of the internet in the United States. But the building itself would still have to remain because of the other missions that occur. And so the resiliency upgrades that we are looking to do would still have to occur because of those other missions.
So it would be in addition, these renovations have to happen.
You have to have them, yes.
And it has to be at the Tier 3 level.
The Tier 3 level is specifically for computing. It's the resiliency projects that we are looking for now are some of the core facility projects that need to occur that would have to occur first before we can start bringing it up to a Tier 3 level.
Bricks and mortar, is that what you're talking about?
Mechanical systems and then some just generic resiliency upgrades. It's a $2.4 million project that are around the facilities to make sure we have reliability and some power and our proper repeaters and breakers that are available.
Okay. Mr. Newhouse, do you have any questions?
Thanks, Mr. Chairman. Thank you, Mr. Glenn. Appreciate you being here. Is it on? Oh, it is on. Sorry I missed the first part of the hearing. I was interested in furthering our conversation about cost overruns at Canon. I can listen to the tape and get your reaction on that if that's already been covered. But what I was interested in feedback you've received from members as we reoccupy the Canon building and some of the complaints that were voiced as to things like outlets, a number of them, and different space problems and so forth. Have you taken that feedback and utilized it for the next phases and how you move forward on?
Yes, definitely. So we've taken the lesson learned from the first phase of turnover, where yes, there weren't enough outlets. They weren't positioned in a way that most people's offices would normally set up. So we've rectified that in the later phases. Also, there was a challenge with the heating and ventilation controls, just understanding how those controls operate so that people could have their offices at a comfortable setting. What we are going to do as part of the turnover process is give a training to each new occupant of the building, so that each new occupant of an office, so they understand how to do all their controls, how to work the lighting, how to work the heating and ventilation.
The rooms are smarter than we are.
That happened a while ago.
Yeah. Okay. And my question as far as the cost overrun, if you've covered this already, please don't revisit it, but just lessons learned as there as well, and how do we look back and learn from what drove those overruns, and how are we addressing that into the future to prevent them? So that was the vein of what I was interested in.
We did talk a little bit about it, the lessons learned, and I'll real briefly go over them, just without going into much detail. Sure. It's centered around a rigid program for change management, so that we don't have we are engaging leadership, so there's multiple people reviewing a change, so we don't get that people proposing too many changes that would rise the costs up that are not necessary. The unforeseens in materials, and then also phasing the turnover of the facility so that the contractor can work their trades in a phased system, and we can turn over to getting the rooms outfitted while they're still working at another level.
Okay, all right. I appreciate that.
And he's going to provide us the categories of where, and how much each of those overruns were, so we'll have a good accounting of that.
Okay, good. Thank you for the opportunity to ask
Yeah,
questions.
absolutely. Well, thank you so much. We're going to submit a couple questions probably for the record. If you can
Thank you.
get back, we're excited to work with you. We're happy that you're here. And we know we got, as we've told everyone who's been before the committee, there's $2.5 billion to go to the 11 other subcommittees, non-defense discretionary. And so we've got to spread that over all of those. So this is going to be a super, super, super tight year for us. And so we want to make sure you know that we're not going to be able to give you what you want, and we're not going to be able to give you what we want either. But that is not an indication of how we feel about the importance of your work and what you're trying to do. So we're going to do the best we can, considering the circumstances and all the additional funding needed for Corona and all this other stuff that's happening now. So.
So I respectfully let me and my staff work with your staff so we can help reprioritize it within what we think is available budget cap would be.
Yeah, we want to stay in close contact with you. All right, thank you. I'm going to put the committee in. Do you have something to say, Josh?
No, off the record.
That gets good when